In chest X-ray interpretation, there are three main parts. One is patient identification, then assess image quality, and then ABCD approach. In patient identification part, we can use patient name, date of birth, and specific identification number. In the assessment of image quality, we need to assess four main parts. Simply we call it RIPE. R for rotation, I for inspiration, P for projection, and E for exposure. Let's discuss this in detail. In rotation, the medial aspect of each clavicle should be equidistant from the spinous process. And also the spinous process should be also in the vertical oriented against vertebral bodies. In the inspiration, the 5 to 6 anterior ribs, lung apex, both costophrenic angles and the lateral lip edge should be visible. Your chest X-ray can be AP or PA view. If there is no labels, assume it is PA film. In the exposure, the left hemidiaphragm should be visible to the spine and the vertebra should be visible behind the heart. So this is the end of first part of chest X-ray interpretation guide. We will meet you soon in the part 2 video. Thank you for watching.